Okay, a few more things here from Strozer. Um, we can become educated about the illness people are dealing with. Now, that doesn't mean that you become a medical professional, but it means that maybe you just spend a few minutes and Google up what they're dealing with so that you know some of the basics of it, so that you can understand what they're talking about, so that you can, because the truth is, you may be in a position where they say, why is this happening? Why does this work this way? And you may be able to say, well, one of the things that seems to be true about this disease is that these kinds of things happen. Just sounding like you're competent in understanding the basics of the illness can sometimes be really helpful. Now again, remember, we're not proposing that you become a medical expert or that you ever give medical advice or that you ever try to take the place of a medical professional. But it is helpful if you're going to be in a helping position with a person to know something about what they're dealing with and not just be completely ignorant of it. Seventh thing, listen to people's stories. The most valuable thing you can do ever for anyone is to pay attention to them and to listen to them. And sometimes when people are in places where they think someone could die, they think their life might be over, they think that their life is going to change significantly because there's going to be a loss. Sometimes people like to tell their stories. It's healing to tell your story. It's healing to have someone listen to the stories about your parents or your spouse, or and be able to talk through that. We heal ourselves sometimes when we're able to share our stories with someone else. So sit and listen. There's nothing more valuable most of the time than somebody who will sit and listen to you. Work toward giving people power, mastery, and competence, like we mentioned before. Just the sense that there are some things you can do. Okay? I don't like the word empowerment too much, but if you can make people feel somewhat competent and give them some sense of being able to control the things that they can control, then you will help them. Normalize as much as you can. One of the ways to normalize is to be very practical and to focus on activities of daily life. If you may be familiar with that term, but basically what that means is how you get through the day. You wake up in the morning, you put your clothes on, you brush your teeth, you comb your hair, you do your basic hygiene. You're able to feed yourself. You're able to just do those basic things that get you through the day. So, for example, if someone's afflicted with a horrible illness, but they can get up in the morning and put their clothes on and make their kid a sandwich for lunch, or get themselves a bowl of cereal, or whatever it is, that's helpful. That makes them feel more like their life is okay, more like it's normal. So sometimes focusing on doing very practical things, feeding yourself, caring for yourself, help people to feel more competent and more normal. Okay, so activities of daily life sometimes are a very important thing. Help maintain developmentally appropriate roles as much as we can. When my dad was getting toward the end of his life, there were ways in which I became more of a parent to him. I'm that way right now with my mom. I'm a little bit more of a parent with her. But it's important even now that there are times and ways that she still is able to act like my mother, that she can still see herself as being in that kind of matriarchal role. Even though functionally she's really not in that spot at all. It's nice for her to feel like she is, to feel like she's the mom and I'm her son. That's a very healthy thing we can help people do if they can do it. So if you have a parent or a grandparent who's sick, if we can figure out ways that they can still kind of feel like they're the parent or they're the grandparent and not feel like they're being treated more like a child, sometimes that's really helpful. The 11th thing here may seem a little strange to you, but it's important in lots of situations. Ask people about sexual functioning, particularly if you're a therapist. Now, if you're in a ministerial role, that may not be something that comes up or is appropriate, but as a therapist, it is. So if you're doing therapy with people who are dealing with illness, especially long-term illness, and especially if they're a couple, it's okay to say, tell me about your sexual relationship. Has this impacted it? Is there anything there we need to talk about? Sometimes people want to talk about those things, but they don't know how. And so a good therapist will bring that up. We'll say, here's a person who's disabled in some way because of this illness. Let's talk about your sexual functioning. How does that happen for you? Are you okay with it? Can we help with it? Can we figure out ways for you to be happier with it? Sometimes people will say it's really not an issue anymore, but sometimes they'll say, oh, thank you for asking. We really need to talk about that. And so that's one of our jobs. Last thing, explore issues of meaning and faith. Now, if you're in a ministerial role, this may be very natural and just happen. People may bring it up to you. But if you're in a therapeutic role, sometimes you may have to kind of figure out how to do that in the best way. Now, you don't have to ask people Christian questions or anything like that, but you can always say to people, you're dealing with a lot of pain and maybe a lot of anger and maybe a lot of disappointment. How does that fit into your belief system? If you ask a question like that, that's not being Christian. That's not trying to proselytize. It's not trying to convert them. It's just opening the door. How do you deal with this in terms of your belief system? People sometimes are very eager to talk about those things. So we should let them, and we should open up opportunities for them to do that when it's appropriate. Now, another way that you can kind of look at dealing with illness is this, and this is a thing that comes from, you can see there, a person named Diane Marsh, who gave us this competence paradigm, and there's a picture of it there. And basically what she does is she says there's a way of treating people in illness that's kind of based on the traditional medical model that puts them in the role of being a patient. And then we can look at it another way that kind of puts them in a little bit more of an aggressive, assertive, competent role. And she kind of proposes that maybe we should help people see themselves in the competent role as opposed to being in the patient role. The role that's based on competence fosters development of alliances between families and professionals. It facilitates identification and assessment and enhancement of competence. It encourages better research and theory. It provides a way for us to design and implement good services. It improves the service system for people dealing with mental illnesses and other illnesses. And it promotes empowerment rather than dependence. And if you look at this, you can see the different models, the different views of the family, all of these things that if we look at pathology as opposed to competence, weakness as opposed to strength, focusing on practitioners instead of empowering clients and patients rather than collaborators, you can see that just maybe sometimes just changing the way we use language when people are dealing with long-term illness might be a real benefit for them. So you can look that over and see that maybe there's some ways that we can help people see themselves as being more competent as opposed to seeing themselves being more pathological. And that might be a really helpful thing for people. Now lastly, I want you to just think about some things here. One of you wrote in one of your responses, and I don't remember who it was, that in the church in particular, and that as Christians, we do a horrible service dealing with death. And I kind of agree with that. I think that we love life, and we should love life, and I don't think we should devalue life at all. But I also think that sometimes we idolize life so much that we treat death as something that's maybe different than we should treat it. That's bad grammar, but I think that sometimes we think about death in a really unhealthy way, and I don't mean to sound silly. I don't want to die. I'd like to try to do everything I can to not die. But I would also like to have a healthy view of death. I'd like to face death and think of death for what it really is, and not as something that it's not. And I don't know if that makes sense to you or not, but I think that's something we really ought to struggle with, particularly as Christian people, and maybe begin to think about death in a different way. So here are just some questions to kind of stimulate that. Since you've read the L'Engle book, and the real point of the L'Engle book was not to teach you everything there is to know about marriage. It's not a perfect book about marriage, but what I thought was good about the L'Engle book is her honesty in facing death and dealing with a husband with cancer, which is a tough thing. So there's some questions here for you to just kind of think about, and maybe you can kind of talk yourself through them and kind of see maybe what they mean to you. What role does death play in your life? How do we approach death within the church? I think we approach death in really kind of an unhealthy way most of the time. And I think that we ought to kind of maybe be able to kind of acknowledge it as part of life and not think of it so much as this evil, wicked thing that's out there ready to get us, but as a part of the natural process of being human. I think that when we're confronted with death, it tends to change us. I've kind of been there. A lot of us have been there in different places. When you are confronted with your own mortality, your life changes somewhat. And I think that's an important thing to kind of consider and think about. So what I want us to do here is just spend a little time thinking about, how do you approach death? How do we think about death? Do we think about death in a healthy way, in an unhealthy way? I don't know what the perfect answer for that is. I think it's good for us, though, to ask the questions and to think about whether maybe we need to help people see death a little differently, at least explore the questions with people. And that may be easier to do in a ministry situation than it is to do in a therapeutic situation. But even if you're a therapy person, if you have chances to do psychoeducation, family education, grief counseling, grief workshops, we can help people learn to think about death maybe in a more healthy way than we typically have. So as I kind of wrap this up, let me say to you, as I've said in the announcements, thanks again for being a part of this. I know that it's been slightly experimental, and it has been for me. And it's been a learning experience for me to try to do this class online. I'm not terribly happy with it, because the part of teaching that I really like is the interaction with students in the classroom. I think that's what I'm best at, and I think that's the thing that's the most fun for me. And I'm not thrilled with doing something online, but it's a thing that we have to do. It's the wave of the future. We've got to do more of it, and we've got to get better at it. So I appreciate you being a part of this, and I hope that I get a chance to deal with some of you face-to-face, maybe at some point in the future. And again, I've enjoyed doing it. It's been a challenge, but I've enjoyed it, and I hope that you got some valuable information out of it. And I look forward to reading your research writing in the next couple of weeks. So I'm going to stop there, and hope you have a good Thanksgiving week. And I'll be in touch with you later on about your research papers.